Welcome to my poster presentation from the 2024 Oregon Nurses Convention, Making Waves. I wanted to talk you through the poster I presented and displayed from May 20th through 23rd, 2024 in Seaside, Oregon. When will we stop talking about unhealthy, burned out nurses? This is what I want to know. Just a few months into my career, I was experiencing burnout and questioning my decision to become a nurse. After years of schooling and training and surviving nursing school, how can this be the reward and reaction and the outcome for so many of our nurses? Dismay and wanting to leave the profession? After years, decades of sacrifice, saving lives, and nursing our patients back to good health, how can nurses be allowed to suffer for their service? After giving so much and the risks we took during COVID, how is it acceptable nurses be allowed to see their financial well-being weaken, their health worse off, and their frustrations with our system often ignored? I created this presentation and named it intentionally, Strengthening Nurses' Financial Well-Being Could Transform Their Health and Healthcare. It's clear to me nurses need to be able to take control of their lives and stop waiting for an outside force to fix it or improve our system. It's taken too long and it is long overdue. It's time nurses understand what is actually within their control and how to start having influence over it. When I see solutions offered for burnout and improving the health of nurses, it's almost always self-care activities, but not real self-care, not addressing the root causes like staffing, workloads, or poor leadership. It's fake self-care, putting the problem on you, the solution on you. You need to meditate more, be more grateful, get more exercise, get more sleep, get in those mental health therapy and counseling sessions already. You need to be more resilient. How about the system just improves so, it's not so hard to take care of ourselves? It takes the emphasis off the root causes for the current state of nurses and puts it solely on the nurses themselves. Nurses shouldn't have to go to therapy to recover from interacting with the conditions of our profession and healthcare system. I don't see a lot of solutions explaining how to reduce your workload, how to have more time for self-care activities, or how using the money from our work could be used for real self-care to create the time and space for healthier activities, experiences, and lifestyles, to remove yourself from poor conditions and toxic workplaces. The focus is almost always on the other pillars of wellness, while financial stress is ignored. But financial stress and considerations impact all the other wellness domains. Financial health was added to the American Nurses Association Healthy Nurse, Healthy Nation a couple years ago, and it's time to effectively reduce nurse stress and burnout. Too often, wellness activities are ineffective in transforming one's lifestyle. And financial literacy and even wellness courses, they tend to be no different. There are too many financial state definitions out there, but financial well-being encompasses them all. It's defined as the ability to manage money, absorb setbacks, and have the freedom to enjoy life and attain your goals and dreams. The higher your financial well-being, the more likely you are able to make these factors defining it a reality. The more control you have over your circumstances, a major factor of burnout is a loss of control. Financial stressors can compound that loss. Time is money. We trade our time for money. Many of the issues facing nurses are related to time and money. They are structural issues contributing to burnout. There might be serious pay inequities amongst nurses by role, region, gender, and other demographics. Nurses' schedules, they're often inflexible, shift hours are long, forced weekends and holidays, constantly changing schedules, recovery from tough shifts eating into days off. There are limits to how many nurses can be off at any time on PTO. We are more prone to illness and injury, and many use paid time off for recovery from the demands of the job, or when losing hours to low census. And that's less time for vacation, leisure, and recharging. When you can't afford childcare and your window for sleep is only 6 hours, I don't care how much counseling or meditation you do, you're not going to get 8 hours of sleep. You can change your reaction to the inability to get 8 hours of sleep, but it is no substitute for the actual opportunity. When someone has to pick up the kids or get them ready for school, and that someone is the nurse coming off night shift, that's a structural issue. When you can't afford to get off nights or change to a less demanding role or specialty, or stop picking up extra shifts to pay your bills, or are made to feel guilty, and it's your responsibility to come in on a day off, Those are structural issues impacting your health. Financially well nurses are empowered nurses. I created a 15 ANCC hour course designed to teach nurses financial literacy that focuses the skills they already have, the nursing process, towards personal finances while using employer education funds and hours to take it. The course guides nurses to develop their own comprehensive financial plan to achieve and sustain a high level of financial well-being, removing barriers to real self-care and burnout. I've been lucky to have a high level of financial well-being since the start of my career. By chance, my first job was part-time, and I worked extra shifts. Since I experienced burnout just months in, I stopped working extra. I was able to work less and give myself the space to recover and adapt to make nursing work as my career choice. Had I moved my lifestyle to match my new income, rather than rapidly paying off student loans and pretty much keeping my lifestyle and spending the same, I might have trapped myself working full-time or more in an untenable situation. My first job was on Kauai in 2006, where the cost of living was insane. We've got to do a better job preparing nurses, not just for the demands of the job, but assuring their finances can support their well-being as well. I've worked part-time 15 out of 18 years during my career as a nurse. That's 600 hours less than full-time nurses work every year, and that is the equivalent of having a full year off every few years. Having ample monthly cash flow has been empowering, allowing me to have resilience, work less, eliminate debt, enjoy a high savings rate, max investments, pay for things in cash, and allowed me to shift roles when I've needed to. As my level of financial well-being has increased, I have been able to overcome and prevent burnout and be more engaged in nursing. I've remained at the bedside, undertaken education for nurses, volunteered, I've done union activism, I've received multiple nursing awards, and this has all strengthened my ability for quality work-life balance. I have more freedom, I have more time, I enjoy ample time for family, friends, hobbies, having good health, and other interests. I've done missions to Rwanda, remained resilient in times of crisis, taken months off to travel, coming off the Great Recession back in 2009 and 2010, and taken max parental bonding leaves after my kids were born. All while enjoying wonderful experiences and having the time to teach my kids the things that I love to do. Several nurses have enrolled in the Financial Wellbeing for Nurses course, and they have expressed a need for the information and an appreciation for the knowledge, and most importantly, they have started to take action. Here's some testimonials from a few of the nurses.
Nurse Abby said, "There were many really valuable and potentially life-changing things in there, so thank you for the wonderful course." Nurse Delaney explains, "The in-depth and multidimensional nature of this course encompasses all the necessary knowledge that might otherwise take an entire lifetime to figure out." And Nurse Vivian, "If you were looking for a good and comprehensible course on helping you navigate avenues towards achieving financial well-being and living a fulfilled life now, while also preparing for financial well-being in the future, then I would most definitely recommend taking this course and doing the homework involved. The course is well written, and Dan makes the videos engaging to watch and learn. I am an older nurse toward the end of my career, but have only recently begun trying to become financially literate. I didn't always pay myself first, max out my workplace retirement plans, or have an emergency savings or buffer in case of an unplanned event. I wish this course had been available to me as a younger nurse, and I highly encourage younger people, not just nurses, take this course. Thank you, Dan, for putting out a very well laid out and educational course that really made me realize what I should have been doing all along. Having it geared toward nurses make it very relatable. But I highly recommend it to anyone who is looking to make their finances work for them now and in the future."
So many nurses underutilize the unique advantages of our career that could help them attain the highly empowered financial state of financial independence. So maybe you've heard of FIRE, financially independent, retire early. I think nurses can actually do something better. I like to think of it as financial independence, remain employed, or FIRE too. And, that's what really could transform healthcare. Nurses no longer begging for staffing and structural changes. They could become the instigators of the change more easily. They could be work optional if needed, leave toxic environments. They have the time and ability to create the change and refuse to continue sacrificing themselves. They don't have to worry about rocking the boat or fear of financial pain. Financial independence is typically defined as having saved 25 times your annual expenses. So a common example is you get your expenses to where they're consistently $40,000 per year, And you save up $1 million, which would be 25 times that $40,000. So now you are theoretically financially independent and you can retire early, simply living off the investment proceeds. Obviously, depending on the economic factors and inflation, the value of your wealth and expenses could change, creating risk that this state won't last. Most nurses could achieve financial independence without much or any sacrifice to their quality of life in approximately 15 years. But most lack the know-how, and they wait until way later in life to actually begin accumulating wealth, which means they lack the compounding value of time, and they'll probably enjoy a worse quality of life in retirement. Or they might be forced to work longer than they should or want to, which, doesn't really help the profession either. So with FIRE 2 and striving for a higher level of financial well-being, most nurses can escape living paycheck to paycheck pretty quickly, in a matter of weeks. They can strive for financial independence, but become work optional much sooner. They can reduce hours sooner to keep investing, let their investments grow, take time off when needed, and still have a reliable income stream from work that they enjoy and love. Over time, they can never need to work extra shifts again either. They could drop from full-time to part-time or to per diem when it suits them and retire at any point. Does that sound transformative? So as the authors write in Practical Radiation Oncologist Journal, quote, robust financial health can lead to financial independence and may facilitate professional and personal freedoms with the ultimate goal of mitigating burnout-associated stressors, end quote. There has been a much larger focus on doctors taking on the structural issues contributing to provider burnout and how financial empowerment can mitigate it. Unsurprisingly, there's not, so much of a focus for nurses there. And what does the evidence say, and is the education relevant? Well, according to Nursing Economics Journal, even CNOs admit that their weakest area of expertise is finance, and these tend to be nurses with MBAs. So how can this be? The authors wonder, could you imagine if nurses didn't know how to check blood pressures, assess patients, or review medical records? Yet when it comes to finances, nurses are easily exploited, whether CNO or bedside. The profession is not better for it. Much of the structural issues we face within healthcare business are financial related. According to the American Nurses Association Pulse study, financial well-being, along with general health, has actually worsened among nurses despite record high pay and high-paying traveler contracts during COVID. So one might wonder, how can this be? But if you actually understand how our system works, and that simply increasing income has diminishing returns towards increasing happiness and life satisfaction, it actually makes perfect sense. Unfortunately, not taking a holistic view of a nurse's finances and creating a plan doesn't get effective results. Ignoring financial well-being of nurses can lead to hard-won contracts and benefits being ignored or lost in union campaigns. Lifestyle creep and inflation can erode the wage gains. Benefits can be underutilized and misunderstood, and the engagement needed to transform and give voice and power to those who do the actual work can be lost, with little to no participation in shared governance. There is a direct staffing and patient impact by not addressing these real self-care barriers and strengthening nurses' financial well-being. I founded The Enriched Nurse because I want nurses to enjoy the quality of life and empowerment my wife and I have enjoyed for most of our career, spanning more than a decade. I take a different approach to teaching nurses not just financial literacy, but how to take action, how to actually analyze their finances and use the skills they already have to create a financial plan, aligning their work to their goals and dreams. With in-depth strategies to help them achieve their plan, they can get results sooner. Nurses deserve to live healthy, fulfilled lives, but they need some help to do it. The course has contact hours, so ideally they can use employer funds and hours to actually get paid to do it. Employers should support real financial literacy and well-being to this end. Our profession and healthcare will be better off because of it. Thank you.